Hello, this is Dr. Daniel Laroche. I'm talking about clear lens extraction with intraocular lens placement, Omni Canaloplasty, and a Hydrus stent. This is my initial approach to glaucoma in persons over age 50 years of age. You can see here, patient with glaucoma, this could be open angle or angle closure, clear lens, performing clear lensectomy, lens removal with intraocular lens placement. This is a multifocal lens the patient opted for, place viscoelastic, then create a side port here for the Omni and Hydrus stent insertion. I tilt the patient's head, place this Katina lens, this gonio lens, use an MVR blade, and make an incision through the trabecular meshwork into Schlemm's canal. I expose Schlemm's canal, make sure that I'm in the canal there. I'll go in with the Omni device, and I'll place the catheter inside Schlemm's canal. I'll advance it 180 degrees to dilate Schlemm's canal, and then remove the catheter, leaving viscoelastic to perform viscocanulostomy. I'll then go in with the Hydrus stent, and I'll place the stent into the canal. This will help to scaffold the canal to keep the canal open. I'll then use a Sinskey hook to insert the Hydrus a little bit further into the canal, and then also perform an adjacent 2 to 3 clock hour goniotomy, just as an insurance policy in case the stent is not exactly in the canal. And then remove viscoelastic from the eye, and then insert BSS. And here you'll see blanching of 270 degrees of the aqueous veins from this procedure, restoring outflow. We published this study, Clear Lensectomy with Hydrus stent in Black and Afro-Latino patients, a one-year retrospective study. 82% of the patients no longer needed glaucoma medications.
Mr. Chamberlain, do I have permission to do this interview with you?
Absolutely, doctor.
Okay, thank you very much. Okay, so Mr. Chamberlain, you were given a diagnosis of glaucoma. Do you remember how high your eye pressure was when you were diagnosed with glaucoma?
I believe it was approximately around 30.
Okay, and then you started eye drop treatments, is that correct?
Yes, Vyzulta.
Okay, and that lowered the pressure to about how much?
I would say maybe around 20.
Okay, and then you continue, how did you feel taking those eye drops?
One eye drop in each eye per night is not the worst thing that you have to do. However, after a prolonged period of time, it gets cumbersome when you have a million things to do, and you have to, right before you go to sleep, take the eye drops. So sometimes you might forget, sometimes you might think in the morning, oh, did I take them the night before? Should I take them now? So unless you mark it down on paper and you're very diligent about it, it's a little cumbersome.
Okay, and so you're how old now?
56 years old.
Okay, and you underwent removal of the lens, and
absolutely.
And how was your vision and pressure after you had removal of the lens and angle surgery?
Well, my pressure is very much improved at 16 and 17 in each eye. I'm able to see clearer because the cataracts kind of gave my vision a brown tint, but now everything is much brighter and clearer.
Okay, now how does it feel to not have to take eye drops?
It's just much better. It's more freeing. It's like not wearing glasses, not putting in eye drops every night. It just frees you from paying attention to yourself, and you're able to concentrate on more important matters. Not that yourself is not an important matter, but it just frees you up.
Okay. Thank you very much.
You're welcome, doctor.
This should be considered as initial therapy in patients over 50 with glaucoma, with highly skilled surgeons for uncomplicated cataract surgery, clear lens extraction, and angle surgery. Exceptions include uveitis and neovascular glaucoma. Manual, small incision, clear lens removal with Sinskey goniotomy can be performed in resource-poor areas. Once again, this is for people over 50 years of age. Further research is required. Thank you.